Hello and welcome to the April Crane Research Forum. My name is Rebecca Dorr and I'm the Director of Research here at the Crane Center for Early Childhood Research and Policy. Thank you for joining us today. We're very glad to have you here. My colleague Kathy is going to be monitoring our chat box and we'll be adding housekeeping items there. These monthly forums feature research on emerging or key topics that impact the field of early childcare and education, and I can't imagine a more relevant topic than the one we're going to be talking about today. I'm very pleased to welcome Dr. Bridget Freisthler, who is a professor of social work here at The Ohio State University. Dr. Freisthler's research focuses on designing, implementing, and evaluating intervention strategies that reduce substance misuse and child abuse and neglect. She partners with agencies in order to make sure this work is useful and meaningful for the populations that she studies. Today, Dr. Freisthler will present research examining how changes in parenting and alcohol use, specifically for mothers of young children, changed during the COVID-19 pandemic due to the stress brought on by virtual schooling, often while managing careers and the safety of those in their household. It's a very timely discussion and important research for us to understand. And with that, I will turn it over to you, Dr. Freisthler.
Excuse me, thank you so much. I'm very excited to speak about this topic. I agree with Dr. Dorr that it's very relevant and we're still learning a lot about how parenting has affected families, stress levels, and substance use behaviors. I also shared that we're in the middle of collecting wave 3 of our data. So this gave me the opportunity, as the true nerd I am, to analyze the data as it's still coming in. So I appreciate that opportunity as well. All right, so for some background, we know that heavy alcohol use is related to child abuse and neglect. A lot of the evidence shows that specifically heavy alcohol use is related to physical abuse. So there's a stronger relationship there. And when you measure neglect by child welfare involvement, there does seem to be a relationship there as well. What we also know, and we're knowing more about, is that drinking context matters. So what does that mean exactly? What that means is that where and with whom you drink can affect parenting behaviors, we think. So people who drink more frequently at bars and home, they use child physical abuse more frequently. People who drink with family are often more likely to report that they watch their children less closely, while parents who report drinking more frequently with friends are more likely to report they leave their child home alone or in the car alone. But we don't really know from these studies whether or not drinking is causing the maltreatment or if there's some other factor involved that we don't know. And so part of the difficulty in answering this is, physical abuse and neglect are fairly rare events. And then if you're looking at alcohol use for people who are doing that infrequently, again, it makes it really difficult to tie it to those parenting behaviors. You also have to really be careful when you talk about this, because if a participant tells you, and you can identify them, that they abused or neglected their child, you're often mandated to report that abuse or neglect occurred. So instead, a lot of these studies, what they look at is an assessment of past year drinking and past year parenting and correlate it that way. That makes it really difficult when you want to try to implement prevention and intervention efforts that focuses on those specific situations that might be most likely to reduce in abusive or neglectful parenting. All right. Then there's also, to add on to that, COVID-19. My colleague, Dr. Jennifer Price-Wolf, we've been working together for years, and she says that COVID-19 was the perfect powder keg, where alcohol use could act as an accelerant when it comes to harsh parenting, so aggressive or punitive discipline, psychological aggression. It would do so for a lot of the reasons that I have on the screen. I don't need to reiterate. I'm sure you all know that. What I will say is that the conditions that occurred during COVID-19, particularly during the stay-at-home orders in Ohio, are those that can both be related to both child abuse and neglect and substance use. So now you have both of those being at higher risk potentially during COVID-19. We also know there's quite a bit of research coming out now that shows drinking has increased by mothers during COVID-19. It had already been increasing. So between 2002 and 2013, there was a 16% increase in the proportion of women drinking, a 58% increase in heavy drinking. Alcohol was actually more accessible during the pandemic. So you could carry it out at restaurants and take it home. It could be delivered from restaurants with your food. And what some of this research is showing that is quite alarming is that drinking rates increased by 323% among women with children less than 5. Let me say that one more time because that stat still bothers me. Drinking rates increased by over 300% for women with young children. There are a whole bunch of reasons this might be happening. We know that the alcohol industry is marketing a lot more to women. They see that as an untapped profit potential. You go on a lot of social media sites and type in the hashtag wine mom and you'll see all kinds of things. So then we've started during the pandemic, we've started to see this normalization of alcohol with a variety of means. These are just a handful of those. And I'm sure you've all seen them, you've probably shared them. A couple of observations I want to make about them. One is that they most often show mothers drinking, very rarely show fathers. So that's one thing that worries me. And it's about coping with virtual school and the stay-at-home orders. As an alcohol research and a parenting researcher, these memes are funny, but there are a lot of concerns for me that I think about. And so one of the lessons I learned from a good friend of mine is that our children are also watching us. When we were talking about me putting together this presentation, she shared that back in April 2020, one of her 10-year-old sons was scrolling through their family Instagram feed that, it's public for all of them so they know what each other is seeing. And it had a lot of these memes. And so she noticed that as he was scrolling, he was starting to get more and more upset. And so she asked him, what's going on? And his answer to her was, is having kids from home so bad that moms have to drink all day? Is being a parent miserable? She then looked over her shoulder at the feed and saw that it was a meme that said it takes a vineyard to homeschool. And the next post was, kids are home, so day drinking starts early. So just a reminder that these memes are helping us cope in some ways, but our kids are also watching this, and it might be less funny for some of them. So now I'm going to talk about a specific study where we started to look at this. In many ways, we had a fortunate accident of timing. Early on, for about 2 years, my colleague Jennifer and I have been trying to put together a study where we are able to survey parents in real time, hoping to get a better sense of parenting and those specific contexts that might be around negative parenting behaviors. It just so happened that IRB got approved in December of 2019, and we were just figuring out how to implement. So come March, April 2020, we were able to put this into the field. And the survey allowed us to assess parenting under these really extremely stressful conditions, and has allowed us to follow these parents over time to see how parenting may have changed, as well as a whole bunch of other behaviors. So the study consisted of an online baseline survey. So we first had parents fill out a short form just to make sure that they qualified for the study. Then they would be taken to a baseline survey where they would ask questions about social support, alcohol and drug use, parenting behaviors. We also included some sections around use of social media as well. We then followed that up where they had a 14-day, what's called geographical ecological momentary assessment. And what that meant is they downloaded an app to their phone, and 3 times a day, the app would push notifications, these 3 brief daily surveys. It would ask them about their stress, whether they had been with a child during the day, where they were when they were completing the survey. And if they'd been with a child, they were asked some parenting questions. During the first wave, we focused on punitive and non-punitive. So we would have 2 of those each. In the second and third waves, we've added positive parenting as well. So we can look at that. Let's see. Recruitment happened through social media and word of mouth. We had a whole bunch of plans to go recruit in person and get parents at libraries in different neighborhoods. The pandemic, not surprisingly, stopped all of that. We had a fairly good sample size. The focal children, we had them be between the ages of 2 and 12 because that was based on the particular parenting questions we were asking. The downside of recruiting through social media and word of mouth is it resulted in a large white middle-class, highly educated sample of mothers. We had a really small number of fathers in the study, about 10%, and only about 15 to 20% were non-white people. So that's sort of a big limitation. And when I'm talking about what we learned in these studies, keep that in mind as well. All right, so I'm going to start and just talk to you about the very first study and what we found, go through that quickly, and then about what we're learning in these more recent ones. So one of the first things we did was to look at what we call at the moment stress. Now, stress was measured on a scale of 1 to 10, and these were some of the factors that we saw were related to stress. So later in the day, parents reported being more stressed, or less stressed, I'm sorry. So a lot of the parents were completing that survey after their kids had already gone to bed. So it was a moment for them to relax. When their child was present, they were more stressed. When they were at work, they were less stressed. And I should add that the numbers of parents that were at work are very small in this sample, again, because most people were virtual home. During the weekends, parents were less stressed. Certainly makes a lot of sense to me because you don't have to worry about virtual schooling, or you don't have to worry about working and making sure that kids are busy. Parents of older children compared to those under the age of 5 were also less stressed. Then we looked at what was the relationship between stress and parenting. And when you have higher levels of stress, we saw higher, more aggressive discipline. So that would be corporal punishment, psychological aggression. So things like spanking, calling children lazy or other names. And then we also saw increase in punitive parenting. And so punitive parenting includes aggressive discipline, but then also things where you might punish children for behaviors. In that third study, we also looked at alcohol use. And so this is really where we started to look at alcohol use. Here, we only looked at alcohol use in the baseline survey, so we don't have at the same time the parenting has happened. But we're able to look at the frequency of alcohol use the past 28 days and what its relationship was to stress and punitive parenting. And what we found, so the blue line is people who don't drink alcohol. And so as their stress level went up, you do see the probability that they're going to use punitive parenting go up. But for parents who reported drinking, both past week drinking and past 28-day drinking, this shows monthly, but the past week graph looks about the same. You see that when they get stressed, the likelihood of punitive parenting increases at a much more quick rate than it does for those who did not drink. And so in this sense, you can think of alcohol use being an accelerant. It might have people use punitive behaviors more quickly than they might otherwise not. Unfortunately, because it was at the baseline survey and not during those daily brief surveys, it didn't really answer the question of how alcohol use was related to specific parenting events. So then comes wave 2, about a year later, so it was about a year ago, we implemented wave 2 with these same parents. We had been thinking a lot about how we could ask alcohol use because we'd been hearing a lot about alcohol use increasing for women. Our concern was if we asked you how you parented and then asked you your alcohol use at the same time frame, we're going to see social desirability bias. I don't want people to think that I'm a bad parent, that I'm drinking and that's when I'm being a bad parent. So I'll change my answers, or I'll not answer as honestly as I might. So we've been thinking about how to ask this a lot, and we thought we found maybe a more gentle way to do it. So instead of asking on the same day, day 7 and day 14, we asked them to think about the previous 7 days. And we asked these 3 questions. So did you drink alcohol during these last 7 days? And then we would ask them on what days. And then if they answered a day, we would say, okay, what timeframes? And we had those timeframes correspond to the same timeframes where we have the brief daily surveys. And so the hope was that we would get parents to answer and we would be able to assess, closer in time to proximity of the parenting behaviors when that alcohol use was occurring. So how well did that work? Well, we thought pretty well. If you look on the column on the left that talks about the drinking frequency that people told us in the baseline survey, And then we have the information from whether or not daily drinking occurred on the EMA. So 90% of our weekly drinkers had daily drinking on that EMA, those brief daily surveys. We got a little over half of our monthly drinkers, about 20% of our yearly drinkers. We even had a person who had abstained in the previous past 12 months on baseline that drank alcohol. So that was a little interesting to see. But lifetime abstainers, or longer than past 12-month abstainers, we didn't get any of those who reported drinking. So what did we find when we did this? Well, first of all, we've been talking a lot about how alcohol use and parenting might be related. And we thought that there were several different pathways. And so thinking about looking at this over these brief daily surveys, one of the things that we thought, if you've had a really rough, stressful day and you've not been parenting your best, maybe you're drinking alcohol at the end of the day to sort of relax and cope. So that was sort of one direction. Could be, bad stuff happened during the day, including maybe not so great parenting that relates to alcohol use. But that would look at the parenting sort of before the time of the alcohol use. And that's what this graph is depicting. The parenting and alcohol use might happen concurrently. So if you're drinking alcohol and you have your child there and they misbehave in some way, does alcohol have you react, or are you reacting in a very specific way to parenting when that happens? And then it could be that in a subsequent time period after drinking, it can still affect parenting. In this particular study, almost all of the drinking occurred in that final time period. And so the drinking the next day would be the parenting the next day would be the next morning. I will say one thing that we learned that we're doing better in wave 3 is that final time period. The survey would happen at 9 p.m. and it would have you think past the past 4 hours. So since the last survey, roughly, which occurred at 3 p.m., that they had a couple hours to take. And so what we didn't know, because parents had a couple of hours to take the survey, if they were drinking after the kids were already asleep, or if they were drinking while the kids were still awake. So in wave 3, we actually break out those time periods more so that we can start to look at that, because we think there's some nuances to that relationship that we didn't quite get before. So what did we find? We saw that when parents report drinking and the parenting behaviors at the same time period, parents were using less non-punitive discipline. And then when we were looking at parenting behaviors in the time period after they drank, they were less likely to use positive parenting behaviors. Now, I will say that's not exactly what we were expecting, because we've really been looking at the relationship between more punitive and harsh parenting that might be indicative of physical abuse. And we weren't really seeing that when you look at these daily EMAs. However, what we did find, let me take a little step back. One of the things that we talk about a lot is there are a lot of parents who don't drink regularly, that they might drink at special events, weddings, New Year's Eve. In this case, we look specifically at the Super Bowl. And the question is, if you're an infrequent drinker, does it change your parenting in a different way than it might not for parents who are more frequent? So in the first 2 questions we might be getting, or the first 2 findings, we might be getting at this parents who drink more frequently. And so rather than behave aggressively, it's sort of more of a neglect type thing. They're just not using any discipline, or they're just not using positive parenting. And so they're just, they might be doing sort of less active parenting, if you will. But when we look specifically at the day of the Super Bowl, I've got to say, we didn't actually plan the survey to be around the Super Bowl. It just so happened. And there's a lot of work that looks at things like intimate partner violence and other violent outcomes around big sporting events. So we're like, okay, well, we have this sort of random opportunity that we can look at this. And what we did find is that parents who drank on the day of Super Bowl were more likely to use aggressive discipline as well. So we don't know exactly what that means. It could be the Super Bowl in itself can be considered a violent event. It was not this year, so it was not, nobody from Ohio was playing in the Super Bowl. I'll clarify that. Or it could just be if people were having get-togethers, maybe those were stressful, they were stressing parents out, and that's where the aggressive discipline was coming from. So definitely something for us to look to in the future. So like I said, we got a little bit smarter when we looked at wave 3. And so partly because we were funded by the National Institute on Alcohol Abuse and Alcoholism. So they wanted more alcohol questions. So instead of asking those at those 7-day time periods, we're asking them about their alcohol use the day before. So we're still not asking it at the same time frame. We're asking them the next day at the 10 a.m. survey. And then we asked, did they drink yesterday? If so, what are the time frames? We've added a new time frame to look at after 9 p.m. So when kids are likely to be in bed. We're also asking quantity. Before we were only looking primarily at frequency of drinking. Now we're looking at how much they were drinking. And we've started to look at where and with whom they were drinking during these time periods as well. You know, were the children there? Were you with friends? Was it just your spouse or partner? All of that. And so just to sort of do a recap before we start looking at these measures across all 3 waves of the study, we have some alcohol measures that we had all 3 time periods. So we have the baseline data, we call them graduated drinking frequencies and continued volume. We'll be looking at that today. Then we have the audit, that's an alcohol use disorder identification test for waves 2 and 3. We have those daily drinking patterns. So we do have those in both wave 2 and wave 3. They're collected slightly differently. But then in wave 3, we also get that daily quantity. It makes it a little bit difficult to compare the 3 time points. And I'll say that a lot as we start to look across all 3 waves of data. But the good news, again, I'm a nerd. It's really possible. It's going to let us do a pretty cool methods paper, I think. So I'm looking forward to that. All right. So this is what this starts to look at over time. So I'm looking at the entire sample and then also with parents who have a focal child between the ages of 2 and 4. Remember, we didn't go lower than 4 or lower than 2 because of the way our parenting questions were worded. And this just, again, as a heads up, these are all descriptives. We haven't done any statistics here. That'll come next. And I'm going to say it so my team doesn't get mad at me. Just a reminder that wave 3 stuff is still preliminary as we're still collecting those data. All right. So what we found is that the percentage of time that parents were with their child was pretty high at wave 1. Again, this was during those initial stay-at-home orders. So just a few parents were still working outside of the home for the most part. And then we do also have parents where they were divorced or not married. And so they were maybe splitting some time with their children. And you can see that for the entire sample, about 91% of the time parents were with their child during the time frame that they were completing the survey. It's slightly higher at 93% for parents with younger children. In wave 2, we see that that has gone down some, although it's still pretty similar between wave 1 and wave 2. And you see in wave 3, at least for the entire sample, that's gone down quite a bit, almost 10 percentage points. It didn't go down quite as much for our kids 2 to 4. And again, it's all quantitative data, so we can't ask what's going on. We also don't know if these are statistically significant differences. But given that several people in my team have children who are under the age of 5, I can tell you there's still lots of concerns around daycare, mostly because if someone gets COVID, there's quarantining. So they still are having to be with their younger children a lot more than with their older children going to school. Again, we looked at the percentage of time when they were answering these surveys that they were at home. You know, again, very high at wave 1, almost 90%. It goes down to the low 80s in wave 2. And then we see a big drop in wave 3, still higher for our wave 3 parents with the younger children, but not as much as when they were first at home. We also then look at the stress levels. One thing I will say that surprised us, this was a scale of 1 to 10. And if you look at this, people were constantly measuring around the 3. And so this was sort of at the moment, what was their stress level? We really expected to see much higher values. particularly during the earlier days of the stay-at-home orders. But instead we didn't. And so one of the things we also have in our baseline survey, we have sort of a global measure of stress, of their perceived stress. And so what we think is happening is when parents are thinking about their stress, over a longer time period, they might be reporting higher stress, but in the moment, they're really thinking of what's happening right now that might be stressing me out. So that's one thing we were looking at. I will say that stress levels for our younger parents were definitely higher. And then you'll see, we expected as we went to wave 2 and wave 3 that stress would go down. You see, it's not really doing that. For the entire sample, it continues to bump up. My guess is those won't be statistically significant findings, so stayed about the same statistically. For young parents, we see something different. We see stress go up and then we see it come back down a little bit. And so I'd be interested if people have thoughts on why that might be, to put them in the chat and we can talk about them, because my team is we're still trying to figure out what that means. And then we also looked at parenting. Reminder, we looked at punitive and non-punitive over time, over all 3 waves, and then positive parenting just at waves 2 and 3. And you can see punitive parenting happens, not a ton. So, only in about 6% or 7% if it's the younger kids. We had in wave 1, we had over 13,000 EMA surveys. We had a slightly smaller sample size, only 90% of our parents participated in wave 2. So we have about 11,000 parenting assessments then. And in wave 3, we're going to get about 85%. So we're looking at somewhere between 8,700 and 9,200 assessments. So we have a lot of assessments, and out of those, it's not overwhelmingly that we're seeing a lot of punitive or non-punitive parenting. We are overwhelmingly seeing positive parenting. And so I think that that's something interesting to note. One of the things that you notice is you do see punitive and non-punitive parenting going down over time. But you also, at least for the entire sample, you're also seeing positive parenting go down from wave 2 to wave 1. And again, we thought a lot about that. And I say a lot as in, the last 2 weeks since we pulled these data. And our thought is that earlier on during the pandemic, parents were with their children very consistently. A lot of the time they were together. And there were, the only other distractions would be the things that were at home, or if they went to a park, things like that. They weren't necessarily playing with other children. They weren't at their own activities. What might be happening as we move into wave 2 and definitely in wave 3, as children are doing more activities, they might be having play dates with friends. Parents might still be present, but they have less need to do parenting overall because their children are otherwise entertained. And so that's one of the things that we will be thinking about and looking at as we continue to look at the findings from these studies. Then finally, we want to look at alcohol use over time. We have some empty cells here, partly because we haven't analyzed all of our data from wave 2. What we do see, and this is what does concern me. So we didn't ask specifically about daily drinking in wave 1, as I've mentioned. From wave 2 to wave 3, however, we see the number of EMA events, the number of our EMA surveys that had drinking was only about 5.4% of the time it was reported. In wave 3, we're seeing it reported at 7.2% of the time. That's a 25 increase in the number of time periods where the parent is reporting that they used alcohol. We're also seeing in slightly different measurements, so we're not exactly comparing apples to apples. The average number of drinks at baseline was about 1.5. During the EMAs, when we ask about that, it's at 1.7. So we're seeing an increase in quantity of about 15%. You still see the same increases, although not quite as large in our parents with younger focal children. So at wave 2, it was slightly higher than the total sample at 5.7% of parenting events, but by wave 3, it did go up to 7% of those parenting events. All right, so I'm going to talk a little bit about what I think that means, but I would, as I'm doing this, I'd like to hear about how you all interpret this and what you think it means in the context of the parents you work with, your own experience during COVID-19, so we can talk about that when I'm finished. Because I do think we're still, like I said, these are data that are just coming in. We're still collecting new data, so we're trying to understand to figure out for ourselves what we think it means. But our experience is just our experience, and we'd love to hear from others what they think it might mean and what they think might be contributing to what we're seeing. One thing that I want to note is that this still does disproportionately impact mothers. We know that mothers were more likely to be caregivers. They were the ones who are leaving the workforce to handle caregiving duties. And we know from historical context that drinking among women in general is going up. So I do worry about what this means for mothers in particular. Alcohol use may affect the attentiveness of parents. You know, if you happen to drink to excess the night before, you might not be doing your best parenting the next morning. We've done some other studies where we've done qualitative interviews of parents, and you know, one that is used as the quote for one of those papers is just get up to parent the next day. So if you're drinking a lot the day before, the goal is to just get up. And so I'm sure you can imagine that that is not the goal that we want for parents most of the time. And COVID-19 was one of those times where you're just hoping to get through the day. And alcohol use can be seen as attractive as a way to cope, self-medicate, all those things. One of the things we've talked a lot in our research, particularly because we think it's going to matter a lot when we start to look more infrequent drinkers, is having the idea of having a designated parent. So if you know one parent is going to be drinking a lot, then have another parent maybe who doesn't drink as much or doesn't drink as all, and who is sort of on duty to make sure they're taking care of the kid and somebody is watching the kid as closely as you need to. This is especially true for parents of younger children, as you know, as we all know, younger children need a little bit more attentiveness until they'll become a little bit more self-sufficient. Just for thoughts about this research, you know, we still have a lot of questions as we've been thinking about it. If you look at punitive discipline and you look at alcohol use, they're pretty rare. And so being able to find that direct connection on what are the situations that lead to aggressive or punitive discipline might be much different than those, as you see, that just general parenting every day. And so we do want to replicate this study with larger sample size and continue to look at this frequent versus infrequent drinking. Like I said, we had the opportunity in wave 2 to specifically pull out drinking around the Super Bowl. In wave 3, it looks like it just so happens that we're getting some parents who are on vacation, which might relate to why the numbers are going up in terms of parenting events. Not sure if it's quite enough to completely explain all of that, but it also gives us the opportunity to, again, to look at where this is happening. One thing I did not mention is that we, as part of the study, we did also ask all parents to put on their geo-tracking. So we would have their location during the time of the day. We were planning to do that with the study anyway, because one of the things we look at when we're thinking about situations and context around parenting is where parents are, you know, so we ask them where they are when they're completing the survey, but we don't know what that looks like when they're out and about regularly. It could be, as we start to look at this geographic data, that, you know, aggressive parenting would be more likely to happen, or punitive parenting might be more likely to happen after, you know, a trip to the grocery store or something like that, some other event that is regular, but maybe increases the stress of parents while it's going on. So we'll be able to look at that geography. And that will also help us when we look at sort of whether people are, you know, at home, at the same home. Some people have certainly moved between these different waves, but if they're away on vacation for part of the time, we'll actually be able to pick that up using the geography piece of this, the XY coordinates as well. So that's one of the things that we're looking forward to doing. The other thing that I want to mention, so if there happen to be any PhD students who are really interested in what we've been talking about, we have lots of data. So we're interested in sharing and finding papers that we can do together. we really want to look at whether the data we get during the daily drinking, during those daily brief surveys, is similar to what we're getting at the baseline survey, particularly as it relates to alcohol use. So can we compare those numbers a little bit better to help put in context our wave one and the changes that are happening over time? I've already mentioned how we want to look at the context and geography. And this is the first time I've certainly looked at the group of the parents that are under the age of 5 throughout this survey. And so we definitely want to look at those more closely and start to tease those out. So I appreciate the opportunity to present here, because it's allowed me to look at this a little bit more closely. We are trying to increase some of the limitations of those first sample. This wave, in wave 3, we've had the opportunity to invite parents to participate. So we were given a grant that allowed us to do that. So we're able to look at more men. We're increasing the number of fathers in our sample. The last time I checked, we were getting about 40% total of the sample. And of those people who were in the original sample who let us talk to their partner, we were getting somewhere between 50 and 52%, I think, of those parents or partners, mostly fathers, participating. This summer, we're planning to collect data from a more diverse sample of parents. Now, we can only ask retrospective pandemic questions, so that will be a limitation, but we do think it's important to look at a much more diverse sample. Like I said, it was largely white, largely women, not very diverse on a whole bunch of things: race, ethnicity, income, so education. So we're hoping to look at those. We're also going to be expanding the study to look at marijuana use. I had been at UCLA for about 13 years and have still colleagues in California. And my colleague, Dr. Freisthler, is still out there. And one of the things we talk about a lot is that as marijuana has become recreational in California, she's seen a lot of parents who are using marijuana on a really regular basis. So we want to see, alcohol in some sense is easier, because we know that about 70% of parents drink alcohol. So we know we're going to get the numbers we need. To start to look at this with marijuana, we're actually going to recruit parents as they leave marijuana dispensaries and see how marijuana use might be affecting parenting, so we can better inform that debate. All right, so this is the point where you can ask me all the questions that you have. But also, I'd like to hear some of your thoughts. So if there are thoughts that people have and they want to talk about those, I'd love to hear that as well. So I think, Rebecca, I turn this over to you.
Yes, thank you so much for a wonderful presentation. We do have some questions and ideas coming in, and please continue to put your thoughts in the chat box and your questions in the Q&A box, and I will share those with Dr. Freisthler during the rest of the time we have here together today. Just one comment coming in concerning your last point about the marijuana use. Stephanie Watkins is glad to hear that you're including marijuana. She hears about parents that take turns getting high while parenting and says that's very, very concerning to her.
Okay, that is a new one I have not heard, and I will probably be using that in a presentation in the future. So that is also concerning. I agree.
Yeah. Some of the questions we have coming in. Jennifer Bostick asks concerning the effects you were seeing over time. As you go through the waves, the focal child is also getting older. Do you think that could be behavior as well? And have you looked at that?
Yeah, it's funny you say that. So when I didn't put it right on my slides, but yes, we're sticking to the under age 5. So by the time that we get to wave 3, we only have 4-year-olds. So in the earlier waves, we have 2, 3, and 4. Wave 2, I'm just looking at the 3 and 4, and wave 3, I'm looking at the 4-year-olds. So yes, I do think that's part, but that's why I tried to look at that. So that is something we're going to be looking at. We do know that punitive discipline happens more often with younger kids, and corporal punishment, often things like that. So that's a very good point. And yes, something we're taking into account, or we'll be doing better of that as we move forward as well.
Yeah, interesting. Thank you. One of my thoughts about across the waves is I was wondering if you looked at COVID rates and stress levels. And I don't know exactly what your time points were and how geographically distributed your folks were, but I wonder if you looked at that at all.
We've talked about that. We have not yet done that. We are also asking, so we didn't get IRB approval in time to add it in wave 3. So we're going to send out a supplemental survey once wave 3 is completely done to look at vaccine rates and vaccine hesitancy. I do think that's why it's interesting to continue to look at the parents of the younger kids. I do think, which actually might help to explain why stress is going higher for parents of young kids, as people are opening up because the vaccines weren't available. That's not necessarily the case for parents of young kids. So yes, I hadn't thought of that until now. So thank you for that. I appreciate that.
Yeah, absolutely. My question was just about COVID rates, but my colleague Kathy was also typing in the chat box, maybe stress levels change as vaccines become available for kids. And so, you probably do have data where like pre any vaccines,
Yep.
and then they became available for older kids, and then they're continually not available for younger kids. That would be really interesting.
Absolutely.
Great. Let's see, another question coming in here. Did you gather any information about participants' careers? If yes, did any trends emerge? I'm thinking about healthcare specifically.
We did, and unfortunately, so because we already had IRB approval in wave 1, we didn't change anything to add specific COVID questions. We do, however, in waves 2 and 3, we do ask a whole bunch of questions looking at things like changes in careers, whether or not they were unemployed for a while, whether or not they were essential workers. We have not. I have a colleague who's looking at that. I will say I haven't looked at that, and I know she's told me things and I can't remember them right now. But if this is of interest, go ahead and email me and we can go ahead and reach back out with what we're finding there. I do know, partly because of, I'm a social worker, and where we were doing some advertising, we do have a decent amount of social workers, some of whom, pivoted to telehealth, some of whom were, for example, child welfare caseworkers, and we're still doing in-person visits and had to work in person as well. So I think it'll be interesting to look at that.
Yeah, absolutely. Well, stay tuned for that. One of my other questions was about your wave 3 data, and where you have amount of drinking, and I wonder whether you could look at like some definition of binge drinking from that, as opposed to just how much they've been drinking overall.
Yes, absolutely. I've already been thinking about it. So yes, because we ask how many drinks during each time period. So, if somebody over the course of a day had 4 drinks, 5 drinks, the binge drinking matters differently if you're male or female. But yes, we can add those up and we can find out what the total number of drinks that they had during a particular day, during a time period. What I did do when I was looking at this is I did combine the after 3 p.m. time period and the after 9 p.m. time period. Now remember, in wave 2, they were together. Wave 3, I'm trying to break them out to look at the difference between when kids might be awake versus asleep. And when I combined those numbers, the range of drinking went from 1 drink up to 9 drinks. So definitely, if you're doing 9 drinks in that time period, you are definitely doing very heavy episodic or binge drinking. So yes, we will be able to pull that out as well.
Yeah, that will be really interesting to look at in relation to some of your other measures about parenting. One of my other thoughts, looking at your, sort of future directions and that data where you are going to have data from the partners as well, is whether you're going to be looking at any sort of like dyad stress, dyad alcohol use, like what that
all of that. Yes. We haven't figured out how to do it yet. But yes, we're one of the things when the grant was reviewed is that they did want us to have a better sense of the parents. So they were asking us just to ask our original participants to ask about their partners drinking and whether their partners drinking had changed over the time. So we are asking that of both the dyad, people in the dyad, but because we got another grant that allows us to look at those partners, we are going to be able to look at those dyads together. We are making sure they're talking about the same focal child for that reason. And then, yes, we'll look at their stress levels. We'll be able to figure out if they're together or not because we have that geographic data. So there's going to be there's going to be so much in there. And when I say not enough time in people, if you know of anybody who'd be interested, we have a lot of data. We also, like I said, we have social media data and use of social media during waves 1 and wave 2
Oh,
that we
wow.
just haven't had a chance to look at yet. So we think there's going to be a lot there to see how social media maybe positively or negatively helps people cope during this time.
Yeah, that'll be really interesting. Yeah, it sounds like a very rich data set and a lot,
Much.
a lot of work. Good. Well, my other question, and I know you mentioned it, was the limitation of the lack of diversity in the sample, and I wondered if you could just talk a little bit about how you think these relationships might look different for a more diverse sample. And I know you're working on that, but just to speculate a little bit, like from the literature, do we know much about levels of punitive discipline and alcohol use for a more diverse sample, and what those relations might look like?
Yeah, we do know stuff about the general population. I think what's interesting to us about this diverse sample is a lot of our essential workers, particularly those who were at grocery stores or other stores, not necessarily those who were in healthcare or hospitals, but they were also expected to go to work. And there's generally a larger diversity, both racial, ethnic, and income levels. And so our questions are, how did that affect them and their stress, their parenting over time? If you're supposed to work at, say, for example, a grocery store, and most of the child cares are closed, right? So then are you potentially leaving your child home alone or with someone you might not normally, because you still need the paycheck, but you're worried about, and you need your child to go somewhere because they can't come to work with you. So those are the types of things we're going to be exploring and looking at to see how that might have affected different parents differently in that way.
Very interesting. Thank you. This has been a wonderful presentation and conversation. Dr. Freisthler, thank you so much for being here and for sharing your work with us.
I appreciate it. It's been very interesting to continue to look at this. We don't say it enough, but parents, particularly of very young children, have really had it the hardest. I shared with Dr. Dora earlier before we came on, a colleague of mine has 3 children, all boys under the age of 4. And she was reading one of the manuscripts, the one about stress that I mentioned earlier. And there's a paragraph in there that says, parents are often more stressed than non-parents. Parents of young children are more stressed than those of older kids. And these aren't pandemic related things. These are just in general. And parents of boys are often more stressed than parents of girls. And she copy edits my work, and she put in there, this is the most depressing paragraph ever. And so just a reminder, for those who have young children, it's been very hard. It still is very hard. There isn't a vaccine. Daycares are still sometimes struggling about what to do when children test COVID positive, often quarantining, which makes, more at home time with parents and kids. And so just a reminder that COVID isn't over for some people in the way that we might like it to be.
Yes, thank you so much for that reminder and validation. And thank you so much to all of our attendees for joining us today. When you do leave the meeting today, a very short survey will pop up. Please fill that out if you're able. We do really value your feedback and use it to inform future events. So thank you all for joining us today, and have a great day.